Hello, my name is Dr. Michael Villanueva and I am a clinical psychologist here at the Alpha Theta Center, and I'm going to speak with you very briefly, I hope, about telehealth. Telehealth is receiving professional services at a distance in a remote environment. Actually, it's not a remote environment. Actually, technically, it's happening in the home environment, meaning it's where the person is. Telehealth is the delivery, in our case, of psychological or therapeutic services in a virtual environment, online, using a camcorder and microphone, and we're having a real-time exchange. It takes place oftentimes in an area that you're familiar with. It'll be in a home office. It could be at your regular office. It could be in your bedroom. It could happen in your living room. But we go by the same rules that we would in a regular office as we would in your home. So for example, is it confidential? Is it safe there? Is there going to be some kid that's going to burst in the room and say, "Mommy, Daddy, I need X, Y, and Z"? So the research about telehealth has been really clear for about a decade, and it's become much more precise in the last couple of years. Number one, it works. It's effective. In fact, it's oftentimes counterintuitively more effective than coming into the office. My hunch about that is that the same depressive, anxious, ruminating thoughts that you come into the office about, you have in your home or office environment. So you're actually receiving the intervention, the discussion between a professional and yourself within an environment where those thoughts happen. So when the session's done, this is what I really like about telehealth, you're kind of in a better space, hopefully, to face the day. When you look around your environment, it perhaps is not as triggering. So there are other benefits to it. I very much enjoy doing it because it puts myself and the client into a different frame of mind. We're really focused on the moment, and you're not worried about, with the office or clock or what I'm thinking about. You really start tracking my face, I'm tracking your face, and it becomes very much of a dialed-in conversation that is a little different than in person, believe it or not. There's just not as much extraneous stuff to distract you. So if you have more questions about this, please feel free, obviously, to give us a call. And wherever you go for telehealth, find a provider that knows how to ask the right questions, that understands about confidentiality in a home environment, and is aware and has some experience. So thank you very much for listening, and have a safe day.